Hi, everybody. This is a podcast where real medical professionals discuss fake medical emergencies. That means that unless you didn't let the Wookiee win, this podcast is not medical advice. If you need medical advice or medical care, please contact your doctor.
Hi, everybody. I'm Jackson Vane.
I'm Johnny Kolosinski. You might remember me from such podcasts as the official Watchmen podcast. My discussion on Craig Mason's discussion on the HBO series Watchmen.
It's too many layers.
This is Hi, Everybody, a Bad Medicine podcast. Every week we talk about what television and film gets right and wrong about medicine and how the body works.
Yep.
What are we talking about this week, Jackson?
So I think you kind of had a teaser about this one maybe a week or two ago, but we're doing The Blacklist today. It's Season 7, Episode 2. It's called Louis T. Steinhil, which I believe if you mix the words around or letters around, it spells The Illusionist. Yeah. So we're talking about this one because this one brought up a lot of controversy amongst my ER friends, but also it's like going around the internet with just a very bad example about medicine in general. But we're not going to start there because that's towards the end of the episode.
We expected to start there. We didn't think that we would have a page and a half of Jackson notes about this episode of television.
This one made me real mad.
We do. Gonna preface this by saying that I watched the first season of Blacklist and didn't really get caught up, and things went off the rails apparently.
Oh yeah, it went way off the rails with like Red's not red.
Red's not red. Elizabeth's not Elizabeth.
Yes.
We knew that Tom wasn't Tom.
Yes. And it just gets worse and worse from there.
Yeah.
But I guess this episode is technically the conclusion from the season premiere. And it kind of starts up with Red, played by James Spader, being abducted by Liz's mom and then strung up on a gate. And someone started an epidural on him to make him paralyzed from the waist down.
To make him think he was paralyzed.
Correct.
Like, to make him think he was permanently paralyzed.
Which I don't understand how that works, unless they put the epidural right in the correct nerve to block the lower part of his lower extremity. Which, I mean, there are epidurals that can do that. Like, if you're about to give a C-section, it'll make you numb, but I don't think it'll make you paralyzed. Okay. So that's a weird way to explain it. But then they were also trying to make him bleed out from his neck.
Yeah, so no one's going to be surprised to hear that I'm a nerd and sometimes read things like Vampire the Masquerade role-playing game books for fun.
Shocking.
But this reminds me of my nighttime reading.
But they did it through the tiniest little IV catheter. We call them a butterfly catheter.
Yeah.
And they put it in there, and I don't know which vein they were going for or whatnot, but to get someone to bleed to death using that tiny little thing will take forever.
Right.
And it'll clot before it'll probably kill you.
Yeah, and so what Liz's mom said in her threatening speech at the beginning of the episode was that the human body can lose up to 40% of its blood.
It's a lot.
That's a lot of blood.
Yeah, I mean, she said that there was 6,000 milliliters in the adult male circulating volume. It's about 5 liters or so. She said it was about a gallon of milk. Fine. It's about a gallon and a half, about. So
we'll give that to them.
I'll give that to them. But then she also said, like, you're going to feel palpitations. It's more like tachycardia, which just means your heart is racing because your heart is trying to keep up with the volume that it's losing.
But the reason she said that they were going to feel palpitations was because there wasn't enough blood in your heart for it to pump.
She said to fill.
Yeah.
Which doesn't make sense.
Doesn't make sense because it's even if you're bleeding out, it's still pretty much a closed system.
It is a closed system. You are bleeding out, but the other part is, so your heart rate and your stroke volume is determined by your heart rate and then like the circulating volume in your blood. Your blood vessels are going to clamp down so that you can increase resistance. And that's why your heart is able to kind of keep up with it, because if you're increasing the resistance and you're basically narrowing your blood vessels down, it'll help return blood back into the heart. Okay. So you're increasing what we call afterload to refill your heart, basically.
So essentially the volume of your veins and arteries is smaller.
Yes, because it's constricting, trying to make up for the lack of it. And your heart's beating faster to make sure you have the same cardiac output going on. Because I think the formula were hammered into us in med school is cardiac output is equal to heart rate times stroke volume. And you can maintain a normal cardiac output by adjusting one of the two, either increasing your heart rate or adjusting your stroke volume to make it equal.
Okay.
So you're trying to maintain homeostasis, basically,
right.
in your whole body during that whole time.
And if you don't do that, according to Elizabeth's mom, you die of exsanguination.
No, she says you're feeling exsanguination.
Oh, you feel exsanguination.
Yeah. She said doctors refer to you losing a lot of blood as exsanguination, which, yes, that is part of it, but the coroners would definitely say you died of exsanguination. Mm-hmm. Really, what I would think of is you're dying of, or you're going through hemorrhagic shock. So you're losing a lot of blood at that time. And she estimated that he was at 20% blood loss. He was pink as a peach during that whole time. He should be super, super pale. And maybe because of the lighting or maybe because it was dark. But later in the episode, you do see that he does look very pale.
But only when he gets more blood.
Correct. Which made no sense. Yeah. And then also they were trying to get information from him. But bleeding someone out is the worst way to get information
because
from someone.
You just get stupid.
Yes. You have no blood going to your brain, so how are you going to give information if your brain is not running on maximum capacity? Mm-hmm. And that's what she was trying to do, is trying to get more info, but you're bleeding him out, and it was real stupid.
So you would recommend the Hobbs and Shaw method of random electric shocks?
Oh, yeah, compared to this. But, I mean, it'll hurt, and it'll sting. As long as it doesn't go through the heart, you're A-okay.
So we get plot magic about them having set up a fake hospital on a soundstage, essentially.
Yeah.
And then we get a little more exposition from the non-doctor.
Yes.
That hypoxia is setting in, and she hears it's quite uncomfortable.
Yes.
What is hypoxia?
Hypoxia means low oxygen of the blood.
Is that something that just sets in?
It doesn't. It sets in. It can go gradually, but usually with hypoxia, I think the best way to explain it is, when you're on a plane and they say put on a mask before you put other people's mask on, it's because the oxygen level is so low that if you lose oxygen, you start acting really loopy and kind of drunk and all that stuff too. So you can't even take care of yourself.
Okay.
So that's the reason why you need oxygen, so you can make decisions to save other people while saving yourself.
So this is adding to the least effective enhanced interrogation of all time.
Correct. Yeah. Because, again, you have someone who's not able to answer any questions and not able to make their own decisions at this point. The other thing is, the thing that's really unpleasant for him, I would say, is not so much the hypoxia, it's shock again. Mm-hmm. So broadly, the whole definition of shock is poor perfusion of end organs. So if you're not getting oxygen to end organs like your brain, your liver, your lungs, whatever, they start to die. And that's essentially what's going on here, is she's slowly trying to kill his brain. Hypoxia is almost like a secondary effect almost, because blood is what carries oxygen to your thing. So if you have no blood, you're going to have decreased oxygen delivery. But I would never refer to it as hypoxia as the way that the red is suffering at this time. And then I think as the scene progresses, the nurse, quote unquote, removes the IV from his neck, and there was no blood at all. This is a big thing that we always see in TV shows, is when people remove an IV, it's super clean. There's nothing going on, and the bleeding just stops right away. This would be a bloody massacre, just blood spraying everywhere, guaranteed.
Even with the tiny butterfly.
Even with the tiny butterfly, you'll still see a little gaping neck socking hole, and just pulse. Pulse if it was in an artery, or just kind of dribble. Ooze all over his neck. And he did not have any kind of dressing on his neck at all. Just pulled it out and let him be. If he was pumping blood, running around, whatever, blood would just start spraying out from that part. So, again, the big complaint we always make.
Not enough blood.
Not enough blood. Needs more blood.
So, the nurse, or supposed nurse, he appeals to her better nature, and she helps him. She helps Red escape.
Yep.
She helps Red escape and takes 2 bags of blood that just happen to be sitting out next to Red.
That's gone bad, probably by now.
I mean, at least we know it's probably a match. Because it's probably his.
It probably is his, or they're just using Oneg. But usually we keep blood in the cooler until we're ready to use it, because room temperature blood starts going a little wonky there.
How long do you think it could be room temperature?
I'm not a hematologist, so I'm not really 100% sure, or a pathologist that works in a blood bank. I just know that, considering the whole circumstances and how that place is laid out, that blood's probably been out for a little while, and it's definitely...
It's been out in the dark.
Who knows if it's what the humidity is or how hot it is in this fake hospital. But that blood probably has gone bad unless they started with frozen and just let it kind of thaw out.
They
gently.
do request frozen blood later.
Yes, they ask for very random stuff later, which we'll get to in a little bit, I guess.
But I mean, even if it was frozen, they drive for a while.
Yeah,
and then
they use it.
Yeah.
But then Red was calling for stupid stuff like goes, I need platelets, I need fresh frozen plasma, which I feel like he just heard these two buzzwords that happen to be yelled at in the emergency department a lot.
Maybe he watches The Resident.
Maybe. Oh God, we got to do a Resident episode. That show is horrendous. But what he really does need is pretty much just whole blood. So he needs everything that he lost. So there's more than just your blood component. Your blood is more than just plasma and platelets. You need red blood cells because clearly that's the thing that he's lost a lot of. That's causing him to think stupidly, and maybe that's why he said all this stuff, because he's lost his wits about him and now he's saying really, really stupid stuff. But I mean, you do need platelets and plasma eventually if you've lost so much blood that you can't clot anymore. But really what he needs right now is packed red blood cells to
carry the oxygen.
Correct, yeah. So calling for that was just silly.
Immediately after he calls for that, fake nurse.
Gosh, it's really bad.
She removes a tracking device from his neck.
Oh, God.
And she does that.
She does it in the weirdest way.
Yeah, so she takes a scalpel. She cuts his neck 2 or 3 times.
Yep.
Like, not deep enough for expanding, I don't know what.
But the other thing is she removed it by using the back of the scalpel.
She flipped it over.
Out.
It was so weird.
And here's the thing: if you did that, and so if you can feel your own neck, it's pretty loose, right? Like, I mean, unless you're chonky, but that's another podcast.
But James Vader is not a chonker.
Yeah, so you can imagine if you tried flipping it, the first thing the thing is going to go is the path of least resistance, right? So it could potentially slip deeper into the neck. Deeper into the neck tissues or neck muscles, because your neck muscles are they're all running up and down vertically, and you can potentially just slip deeper into the posterior part of your neck before you can actually remove it.
And your goal with removing a tracker is to remove the dang tracker.
Yeah, as quick as possible without damaging what's underneath. So her flipping it too, you have to leverage, right?
Yeah.
And if you're leveraging it, what's underneath is your carotid and your jugular. So she could potentially cause a stroke.
Oh, great.
Because she's pushing on these big arteries and whatnot, and by occluding blood supply, could fire a clot. I don't know how healthy Red is.
Yeah, well, he's less healthy than he was 2 days ago.
Correct. He could have had a clot in his neck, some kind of embolus, and that could have fired up into his brain.
Could have had a clot from the bag of blood that was sitting out on the countertop.
That probably would have stopped in his vein that the nurse put in horribly too, which I gotta mention that part where she put the butterfly catheter parallel to the elbow basically.
At least it wasn't a right angle.
That is true. At least it's not a right angle, but now she's completely flat, and then the way they just put it on, didn't insert it or anything, and then just put bandage on
just
top
taped
of
it on.
Yep.
Going back to the scalpel, reversing the scalpel like that would also be a sanitation issue, right?
Oh yeah,
because there's the part that you've been holding with your hand.
Her cutting him was a sanitation issue too. There wasn't any sterilization. They didn't wipe it with alcohol. Yeah. They just sliced and...
True.
I don't know if the sound got on there, but that's what it sounds like on there. But yeah, they take him to Dom, which is a backwoods Russian doctor, but also Katerina's dad, Liz's grandfather.
Don't try to follow
I'm
this,
trying.
guys.
I'm trying just to
Brian Dennehy.
But yeah, they took him to a backwoods Russian doctor, given some plasma, and he perked up right away.
Oh yeah, immediately.
Yeah. And then the other thing that worked too was his neck wound healed very quickly right after that too.
That's because they had tape.
They did not put tape on his neck.
Oh, they didn't tape his neck up?
No, they put nothing. They just left that wide open. There was like maybe a little scab, but that should be a wound that's bleeding and just disgusting in general. But that's not why we're talking about this episode.
No, we're talking about this episode because later Brian Dennehy gets shot.
Yes, he gets shot in the left side of his chest near his heart. And right when I saw that, without kind of knowing what happened later, the first thing I said was, there's going to get a pneumothorax, which is like a collapsed lung, a hemothorax, which means he's going to have blood in his chest cavity, or he's going to have cardiac tamponade, which is the same thing Dr. Strange had after he got stabbed by a mythical tool. But he also had like a sucking wound. And we call it a sucking wound because it is a wound in the chest that if he was breathing, you would hear a distinct...
Every time you inhale, it makes
a sucking sound.
Yeah.
Like, it'll actually sound like a sucking sound. And so combat nurse now reveals herself as combat medic, is saying that she wants a hemostat right away, which I started like gasping and giggling, and you were like, why are you laughing?
Yeah.
A hemostat is essentially tweezers that lock. That's all they are. Gigantic tweezers that lock. That's not going to do anything to stop this guy's bleeding unless you can find...
Because he's been shot in the freaking chest.
Correct. Unless you can pinch his entire wound with the hemostat, it's impossible. So then she heals him with duct tape. Or they were looking for gauze or some kind of bandage. The real thing I think she was trying to say, or at least the show was trying to imply, is quick clot. Which is kind of a fibrous material almost.
I think we've talked about it before.
Yeah,
that it's like fix a flat for flesh.
Yeah, so you can actually use that. But the last thing you want to do is put
or a
that...
tire patch.
Yeah, and the last thing you want to do is put that kind of expanding thing in a chest.
Right, because that would push all the organs around and get...
Well, mainly it'll make sure that lung will never... Well, not so much that. But it's actually make sure that lung will never expand again.
Oh.
Because think about it. If that's expanding rapidly inside... you're not going to be able to expand that lung anymore. Okay. So really the treatment we do with a gunshot wound like that is we do an occlusive dressing, but we tape it on 3 sides only. The reason why is, you can think about it, if you breathe out, air can come out. When you breathe in, it sucks in and you can't get air in. So you're trying to prevent it from turning from a open pneumothorax to a tension pneumothorax, which eventually that is what Dom gets, is a tension pneumothorax. And what that is, it's the air is expanding so much that's pushing your heart, your like aorta, all the big vessels to the other side of the chest. And it's under so much tension that it's actually making it hard for blood to return back to the heart. Okay. And that's when your blood pressure drops, and that's when you arrest. Okay. So usually the treatment for that is you need to put in some kind of chest tube to relieve the pressure.
Yeah, they do. And we are just now finally getting 35 minutes into the episode of Blacklist, and we're getting to the one medical moment that brought us to this show,
which made a lot of people real angry. Like, even my doctor friends at work were just straight up saying, you need to watch this clip. This is the dumbest medical scene we've ever seen in our life. And I watched it and I just said, I can't watch this anymore. This is horrible.
It was, yeah.
So they take him not to a hospital because they said if any Rostova goes to a hospital, there's going to be questions that ask. So they take him to a black site. Like, they set up a triage tent. They're waiting for a doctor to show up to put this chest tube in. Right. And this combat medic says, I don't know how to put in a chest tube, which makes no sense at all. Right. Because if you're in the field, you learn basic paramedic stuff, and part of that could be just putting in a tube to save someone's life. This is very basic, simple stuff. So then I'm going through this step by step because it was killing me.
And all of this is on our social media. You can watch this scene.
The scene in particular on there. But I forgot to mention, the worst thing you can do with the tension pneumothorax is they had that gap that they duct taped that guy's chest. The last thing you want to do is open that up right away to allow more air to rush in and cause the tension pneumothorax to get worse. And that's essentially what she did. Sometimes you just need to put a tube in there to help drain it out too. Because part of if I was in the field and I saw someone with a tension pneumothorax, I would actually get a needle, a pretty big gauge angiocath needle, and pop them right between the second intercostal space, right in the midline of your clavicle.
So he's showing me on his body. It'd be above the heart.
It depends on which side, but it's the second space of your ribs, of your chest. And then we put it in there, and usually if that works, you hear a whoosh.
So very high on the chest.
Yes.
And outside.
Mid-clavicular line. Yeah. So middle of your clavicle. So that's what we would usually do. And so she should know how to do that. So,
now what's the purpose of the chest intubation that she's doing?
So with the chest tube?
Yeah.
The chest tube really is to decompress the pressure, get the blood out, but also give a chance for that other lung to reinflate, because the biggest thing that fills up that lung is a lot of nitrogen. And because, the atmosphere
is mostly nitrogen.
So you're trying to get all that air out. So you're supposed to connect that to some kind of suction or seal or something like that to slowly re-expand the lung. It is not a pleasant procedure. It hurts a lot if you're awake, because you can only imagine, like, I'm sure you've taken a weird breath before and you feel like you pulled something inside your chest. Yeah. Now imagine that constantly with every single breath you take. Not fun at all, right? So she's calling for a knife. She doesn't know what kind.
She doesn't care what kind.
Just a knife.
I'm not a doctor. I've seen some medical shows. I don't think you call them knives.
No. Well, sometimes we'll call them blades sometimes.
Okay.
Knife is not the term I would probably use. I'd probably say scalpel or blade. And then you should know which kind, like an 11 blade or an 8, 10 blade or whatever blade you want to use. So you call for a blade. That's fine. But then she goes in the 7th intercostal space, which is super low.
Yeah. Again, you showed it on the body, and it's like your natural waist.
It's where you. It's a little above that. It's pretty high up there. The only problem with going there is if you're going on the right side, if they have a very high liver, you can go there. You can potentially injure a diaphragm if you catch them at a weird breath. Really, you're supposed to go between the 4th and the 5th intercostal space. So that's around your nipple line. And I was telling Johnny earlier, the mnemonic we're taught is you go around T4, which is the teat pore, which is the easiest way for us to remember it. So that's where you're supposed to make the incision. So then she asked for the smallest ET tube size possible, which again, the smallest ET tube size possible is probably about a 3.0, which is smaller than a straw. In cases where you're doing like trying just to get air out, that's fine. Because we use something called a pigtail catheter, which is really skinny. But with that much blood in there, it's going to get clotted before it does anything. So you want the biggest, fattest.
You want something big that's going to get as much out, have as much volume space as possible.
Correct. And the tube they use is definitely not the smallest ET tube they have. And also, ET tubes are real flimsy. So they're not going to withstand the pressure of putting it in. And the way she put it in is not the right way to put it in either. Because she was trying to like thread it into the chest. The way I was taught, and I'm sure most of our listeners, if they're medical, they would understand this too, is you make the incision, you kind of dig down, and then you're digging your finger in there to try to make a space and kind of keep your finger there. Mainly because the minute you pull your finger out, the pleura, which is the membrane that lines your chest cavity where the lungs is very tight. And once you remove it, you might lose it. So you're supposed to ride over the rib and then insert it in with the tube on your finger. And then the clamp is like right there too. And sometimes your clamp is right there just to help push it in because you need that traction. And then once you feel the pop, that's when you kind of advance the tube in. And it's a big tube with like extra holes on the side of it to allow for more blood to come out. It's not a pretty procedure at all. I think on real patients, I've probably done like 3 because they're pretty rare. At least in kids, they're pretty rare. On fake, like cadavers, I've done a bunch of them. And it's still the same amount of resistance that you're trying to go through. So they put it in, and the clamp is like super high up, and the blood doesn't come out right away. This is someone who's supposed to be supposedly under so much pressure that it's causing them to die.
Right.
The blood's not even coming out.
The blood doesn't come out. It doesn't come up and hit the clamp and stop the clamp.
Correct. It has to be.
Was that clamp a hemostat?
It's a big old hemostat.
Okay.
I think it's like, I think the term for it is Mayo, but I'm not a surgeon. But I think of it as a gigantic hemostat more than anything. And then they do the dumbest thing I've seen.
Right. So, and you told me about this one, so this is why I understand what was going on.
Yeah.
So there was no blood below the clamp, but when they removed the clamp, all of a sudden the blood rushed through and into the bag that they were using to ventilate.
Yeah.
It looked like a big plastic barrel.
Yeah, it's like we call it it's a bag valve mask, or it could be called an ambu bag. That's like the brand name, but it's a one-way valve. Those are valves that are designed that when you put it on someone's face and you squeeze it to give oxygen or whatever air it's connected to, it could be room air, it doesn't go back into the tube. It fills up from the back. Just like inflating your inflatable mattress. Correct. So once they hook it up and you just see the blood go through, that means it was under a lot of pressure to actually pass through there. But that's not normal standard practice at all. Normally the standard practice is like we hook it up to a vacuum or some kind of water seal so that air can't re-enter into there. And I get what they're trying to say is like, oh, look at all this blood. Look at all this blood that went into there, but the blood's not going to go back. It's A-okay. That is not sterile. It is not good at all. You can't measure how much blood came out. You don't know how much pressure is suctioning out or anything like that. Like, that is the most cringeworthy scene I've seen for medicine period. And this is like seeing people use suction catheters as an ET tube in patients' mouths. Like, this one's really bad.
This one's really bad to me because it was the focus of the episode.
It was.
Because it wasn't just like with somebody using the wrong tubes and things like that. That's a production issue.
Yeah.
That's we're working with what we have and we don't have somebody on site.
Correct.
We're going to do an episode that's all about medical stuff.
Yeah, this was a very medical heavy episode of The Blacklist, and it was just horribly done. And I think one of the excuses I heard was, oh, they're working in a black site, they don't have all the tools needed. I don't think that'd be the opposite. I think that's the opposite, because even said, like, we have a triage tent set up and all this stuff. They should have all the stuff they need to be done. And let's say they did have to use an ET tube, right? You can still hook it up to the proper things to make it look real. Like, an ET tube can potentially help with the chest tube, because a tube's a tube at that point, right? But calling out the stuff the way the combat medic made it sound like they didn't know what they were saying.
Right. When the goal was to specifically show her competence.
Correct. And she had some competence. I mean, the whole first half of the episode was to show how she was pretending not to be competent, but was very competent. Yeah. And then all of a sudden they cut to how she was super, super inept. In like a very short arc.
But the ineptitude was not visible to the layperson.
Correct. But to any emergency staff who have all seen this clip,
and everyone has,
holy crap, people really hated how, not so much hated, but also just laughed about how bad this scene was. And this is the joke we always make.
I think you and I both saw this on our own social media at the same time.
Yeah.
I saw it via a nurse friend.
Yeah.
And you saw it via everyone in the world ever.
Yeah. Oh my God, I just forgot about one. They just showed something that I totally forgot, was the patient who, when the crew was trying to find this one guy and then he shot himself in the head, and they faked it.
Yes.
The whole time it was a fake.
And they
actually showed enough blood for someone who got shot in the head.
You actually commented on that.
Except the exit one was nothing.
I was thinking in my head that, they're faking this because they teased it earlier with somebody with Phantom of the Opera makeup.
Well, I didn't realize his name was G Host.
No, yeah, that was
which was terrible. This show has so many terrible puns, and I enjoy terrible puns, and this was too much. It was too much for me. It was crazy. But yeah, there was a lot, like that one scene probably riled up more of like the nursing doctor community more than I think I've seen any other scene recently.
Yeah.
And that's coming from a guy who's watched like Grey's Anatomy with the fork in the neck and they wanted to do an MRI, which we'll touch on at another point.
Which we've touched on in person.
Yes. Terrible phrasing.
Yeah. So, yeah. So, the human centipede bills itself as 100% medically accurate. If that is true, how medically accurate was Season 7, Episode 2 of The Blacklist?
This is terrible. So, I will say this. Some of their explanations and medical interventions that needed to be done, relatively accurate. The gigantic cluster of all of it made it lose a lot of medical percentages.
Okay.
Definitely not as medically accurate as the human centipede. I think you can agree on that too.
I think so too.
As a layperson, you would probably say that. I would probably say it's like 40.
Okay.
Like it's one of the lower ones I think we've ever done. Like it's less medically accurate than Hobbs and Shaw. That's saying a lot. The lady ran around with a backpack dialysis thing, and still this is less accurate than that.
I think Hobbs and Shaw was around 40 or 50.
Yeah, I would say this is like fine. I would drop this at like 30 then.
All right.
Yeah, I can. No.
Normally, I would ask now, what would you do to make it more medically accurate? But I think the answer to that is make it more medically accurate.
Yeah,
because there was nothing about the medical inaccuracies that were there to raise the stakes.
Yeah, there was the stakes were there.
Mm-hmm.
Like everything that needed to be, the stakes were all raised. It all went down to how to portray it to look scary. Like, let's say they were in the combat field kind of thing, and all they had in their rescue kit or their life pack
was a Bowie knife and
all that stuff.
Then a stapler.
Then I get it, you know? But this is one where they had everyone gown up, make it look like it was a proper surgery kind of thing,
And then just wing it.
And then just completely wing it. And there was no anesthesiologist. I don't know why they used the ET tube there. I don't know what they put inside of his mouth, but that didn't look right either. Like, they're showing the scene and he's just on oxygen during the whole scene. Like, I would feel like if you were on some kind of situation like that, you want someone controlling your breathing during that time, putting in the tube and all that stuff, and not just putting him on oxygen and go, he'll breathe eventually.
Yeah. But none of this was stuff that felt intentionally wrong to make it more dramatic.
Correct.
It was just wrong.
It was just wrong and prideful, because they could have had help, and they didn't take it. And that's why this episode felt so much more angering than any other episode that I think we've done, is because there was no reason to do the medicine this badly.
James Spader, if you're listening, hi everybody podcast at gmail.com or at hi everybody MD on Instagram, Twitter, and Facebook.
Can make this look better. We can make this a lot more fun. But it's the Blacklist too. It's shenanigans in general. Yeah. I'll watch more Blacklist if it means I can be a consultant. But this episode, I mean, there's so many things we could have made better. The tubing, or putting in a chest tube, even putting in a real chest tube and showing the procedure is tension filled in itself, because seeing a doctor's finger having to get dug into there to get the tube in, that looks dramatic and scary as is. Also, her gloves, if I remember correctly, never bloody. With someone who's covered in blood and you're touching him a lot and you're not bloody, what the hell? Yeah.
Not enough blood.
Not enough blood.
Never enough blood.
Always a complaint. There was one scene with enough blood, but it was
a
fake.
fake.
Screw this episode. No more. But yeah, that's all I gotta say about that. I wrote a lot for an episode like this. I wrote way too many notes.
Yeah, we figured this was going to be a quick and dirty.
We thought this was going to be like a quick 15-minute whatever. Yeah. We're done. No, we've been talking about this episode for way too long.
Yep.
Yeah.
All right. So we'll be back with more Hi Everybody next Tuesday.
Yep.
And until then, let people know about the show. And thank you everybody for listening.
Thank you.